The breakthrough came when 8 Senate Democrats crossed the aisle and agreed to end the shutdown without a guaranteed extension of the Affordable Care Act, also known as Obamacare. It was only an agreement to hold a vote by mid-December on extending expiring health care tax credits. Those Democrats admitted that keeping the government shut down was not a winning formula.
As of this morning, there was a 0 chance of having a work on the ACA. Now there's a measurable chance. Will it be everything that everybody wanted? No, because we need 60 votes.
But here's the thing. We can open the government and we can still fight to address this looming health care crisis.
Their position angered other Democrats, including Senate Minority Leader Chuck Schumer, who voted against ending the shutdown.
I must vote no. This health care crisis is so severe, so urgent, so devastating for families back home that I cannot in good faith support this CR that fails to address the health care crisis.
However, it's average Americans who are being hurt by a shutdown that's now past 40 days. Federal workers are going without pay. Nearly 42 million people who depend on SNAP benefits are in jeopardy, and airline passengers are experiencing major delays and cancellations.
17-hour layover, so that's a whole day off my vacation.
On Sunday alone, U.S. Airlines canceled more than 2,700 flights, and there were 10,000 delays, mostly due to the Federal Aviation Administration's order to reduce air traffic because of fewer air traffic controllers. Transportation Secretary Sean Duffy warned that with the holidays coming, the airlines might have to cancel 1 out of every 5 flights by Thanksgiving if the shutdown didn't end.
As I look 2 weeks out as we get closer to Thanksgiving travel, listen, I think what's going to happen is you're going to have air travel slow to a trickle.
With now little chance of victory on funding Obamacare, it's going to look to some as if the government shutdown accomplished nothing. President Trump on Truth Social said money for Obamacare should instead be sent directly to the people so that they can purchase their own much better health care. The measure in the Senate would keep the government open through January 30th. However, it still faces a series of votes and could take several days to pass both the Senate and the House. Dale Hurd, CBN News.